Thank you, Dr. Ali Fahmy. Very insightful findings. Now I'd like to turn it over to Dr. Shadi Saraf, who will discuss the work of the International Lebanese Medical Association to conduct vaccine outreach in traditional as well as social media, as well as their efforts to partner with local community organizations. Shadi, I turn it over to you.
Hi, thank you. Thank you, Dr. Shukir, and your White House team for organizing this amazing webinar. I'm the current president of the International Lebanese Medical Association, the USA. I want to thank my dear friend, Dr. Francois Bifadel, for helping in the connection and make this happen. He couldn't be with us today. I want to start with my personal experience. I'm a hospitalist. I practice in the hospital, and I witnessed firsthand the historical pandemic when it started and the many lives we lost due to the virus. I still remember the day that the vaccine arrived to our hospital and how relieved we all felt waiting in line to get the vaccine. We encourage our parents, families, community, and patients to do the same because we believe vaccine saved lives. Today, I'm very worried. You know, I'm in Kansas. My county vaccination rate is 45% in adults, and that's very low, as you know. And in the last 2 weeks, our COVID-19 hospitalization doubled in the hospital. We're seeing 90% of those patients are not vaccinated. So there's still a lot of work to do, and this is why I guess we're here. In Alma, we identified a few factors that we think the Arab American communities struggle with and cause vaccine hesitancy. One of the most common one is access to healthcare and access to actual vaccine. Second one was the language barrier is another major factor. And third, I think, was mentioned before me is the misinformation spread through social media. And that was really a big factor in vaccine hesitancy. Even sometimes media channels were part of circulating the misinformation, not relying on science. The last one we think is obviously the politics that did cause some mistrust in the vaccine, and that was another barrier for us. Now, what we did in Alma, we reached out to our local health institution to partner with them with the vaccine campaign. One of the very good examples we did, and it works very well, we helped them translate to Arabic their vaccine flyers that address vaccine information and side effects. And at the same time, we addressed those misinformation about vaccine in native language to reach most of our Arabic community in the States. The other thing we really work campaigning with the local TV channels. We guided interviews locally, and you know when our community see familiar face on TV talking even in English about the vaccine and answer their concerns and questions, they feel more comfortable about going ahead and taking the vaccine. The other thing locally we did is reach out to the FACE institutions. We were available to consult and answer concerns and questions to their communities. Some FACE institutions actually serve as a vaccine centers, which was very impactful to us. Next, we went to the social media, which is the main platform where all the information and misinformation is circulating. So we were updating our websites and our platforms regularly about the new studies and summarizing the vaccine safety and efficacy. Then we recorded a short video, and we had a physician from Alma from all over the country. They recorded in Arabic and addressed the 10 most common misinformation about the vaccine. That video went viral, mainly in Lebanon, and here we had hundreds of thousands of views and shares, and that was really a good step we did. We then we did the international video. We had our Mother International Association. We had doctors from all over the world who recorded in Arabic and English, same thing, short videos about the misinformation about the vaccine, and that went viral too. Last, we did interviews on Arabic channels that are streamed in the US. We addressed, initially the COVID-19 pandemic, and then we talked about the vaccine updates and any concerns and questions that the public had. We did webinars. We invited, trusted figures from back home that are working on the vaccine, and that was really a good step to, increase the confidence in the vaccination. Last thing I want to say, where most of the public concerns and questions are legit. We need to hear them. We need to listen to them. At the same time, we have to find ways to reach out to them and assure them that we took the vaccine And there's a lot to do and to work on because we need to get over that pandemic and go back to our normal lives. Thank you.
Thank you, Shadi. That is just fantastic and great work. And I'm so proud to be part of some of the efforts and promoting some of the efforts that you've led. Now I'm going to turn over to Dr. Aisha Jumaan, who will be discussing some of the successful efforts